Welcome everyone to today's webinar. We're really pleased to have Kay Perrin with us. She is author of 2 new titles from Jones and Bartlett Learning, Essentials of Planning and Evaluation for Public Health and Principles of Evaluation and Research for Healthcare Programs. My name is Sophie Teague, and I'm the Senior Marketing Manager for Public Health and Health Administration here at Jones and Bartlett Learning. And for those of you who are not familiar with Jones and Bartlett Learning, we are a provider of instructional assessment and learning performance management solutions for the secondary, post-secondary, and professional markets. And we specialize in the areas of health and safety. Before we get started, let me take you through just a few quick housekeeping items. First off, all of your lines have been muted in order to minimize background noise. And once the formal part of the presentation is complete, our operator, Erica, is on the line, and she's going to open up the lines for a question and answer session. And you'll have a chance to ask your questions. She will give instructions for how to do that. And you can ask your questions, verbally, or if you want to use the chat box feature, which I will show you later on, you can use that as well. Second, the entire session is going to be recorded, and following the webinar, I will send out an email to all the participants with a link to that recording. That should be sometime early next week. You'll get a link to that. And then finally, if you're interested in obtaining a complimentary review copy of either of Dr. Perrin's texts, if you want to consider them for course use, best thing to do would be to send me an email, and I'll be sending you an email, so you can simply reply to me, and I'll get connected with your sales account specialist to get you a copy of the book. Let me now briefly introduce you to our very special guest presenter, Dr. Kay Perrin. Since 1990, Dr. Perrin has held faculty appointments at the University of South Florida College of Public Health in the Department of Community and Family Health. Prior to obtaining her PhD, she worked as a registered nurse in a variety of public health clinics and hospital settings for over 15 years. Currently, Dr. Perrin is an associate professor and assistant dean for the Office of Undergraduate Studies, where she oversees all aspects of the newly approved undergraduate degree that they have there, the Bachelor's of Science in Public Health. Dr. Perrin teaches both undergraduate and graduate level courses, and her research focuses on adolescent health with a special interest in teen pregnancy. And Dr. Perrin also serves on several community boards within the Tampa Bay area. So with that, I will now turn things over to Dr. Perrin. And Dr. Perrin, I am passing the presenter privileges over to you.
Okay, thank you very much. Welcome everyone. Thank you for attending this afternoon. As you see on the slide, we'll just move forward. Yes, it's working just fine. The 2 texts are what you're seeing there, the Principles of Evaluation and Research for Healthcare Programs and Essentials of Planning and Evaluation for Public Health, and that's the latest one in the Essentials of Public Health series put together by Dr. Richard Riegelman. So one of the major questions that people ask is, well, these books look kind of similar, so what's really different and what would be the most appropriate use for the Principles edition over perhaps the Essentials of Public Health? Well, as Sophie mentioned, my background for about 17 years before I came into public health was nursing. That gave me the expertise to write the research and evaluation text with a very strong focus on nursing, medicine, pharmacy, and physical therapy. The other thing that I have done in the Principles book is I sprinkle in quite a bit of medical terminology. So if these students need either a beginning sort of text on a little bit of medical terminology, the examples I use in the Principles book, I give the medical terms, for instance, an acute myocardial infarction, and then I put in parentheses or explain later in the text that that would be a heart attack. I want the students to learn the proper medical terminology, and in that book, all of the examples of research are clinically based. And in the Essentials book, it involves program planning and evaluation instead of using a research background. It's mostly program planning, and all of the examples in that book are from only public health with a minimal of the medical terminology, where the other book has more medical terminology, but you can sort of get the feel of what the two different books and how they are different. Now, some of the features for the students, and I've been teaching out of the principles book because that's been out a little bit longer. I had two classes that I was able to teach out of the book when it was still in the development phase, which was great fun for my students because they were forever on a hunt to find errors that they could point out to me, which was also very good. So I had like 57 proofreaders, but they really enjoyed the easy-to-read style. That's how I teach, and so that's how I write. I didn't want to make it for either of the books complicated. There's no point in making a subject more difficult than it needs to be, and I really believe that not only as an instructor but also as an author. So as a result, the books have case studies in them which give them very real examples, but not from real cases. They're cases that I wrote to illustrate specific points in both of the books. There are also student activities. For instance, in the Chapter 3, in the Social Determinants chapter, I have the students, or I suggest to the instructor that the students do a health history of their own immediate family as far back or as far in breadth as they know. And then they begin to realize that we're not talking about those people that we always kind of hear about, and it brings it home, so they're thinking, this is really about me. This is not a personal wellness course, but if you're looking at social determinants of health, it's not only the people that we may be serving in the clinical or the public health realm, but it's the real people around us. Another example in the social determinants section is I'm talking about health literacy, and you can be very health literate, but the example that I give is a little scenario that I had one of the faculty members here translate into Chinese. So even though you're very health literate in the United States, as soon as you're a tourist or a traveling tourist to another country with a different language, you quickly realize that you are completely illiterate. So it doesn't mean that low literate people in health literacy are always low literate. It may just mean that they have no English language skills. So I wanted to sprinkle in some global health on that. And then lastly in that chapter, for an example of student activities, we have them go to the U.S. Census. And there they go on a fact-finding treasure hunt, and they have to do some simple calculations. That does a couple of things. It introduces them to the concept of epidemiology. It also introduces them to the valuable website of the U.S. Census. So that just kind of gives you an overview of what kind of student activities are available throughout the book that make it more real instead of just always hypothetical things. And then I also used text boxes throughout the chapter to sprinkle in a little bit of, well, you may want to think of this. I know that in one of the chapters I have a history of HIV, and given the fact that none of these students have any memory of life without HIV/AIDS, it lets them know how things have changed over the past 30 years since the influx of HIV. So that gives you kind of a little example of how that works. Also, in in the text itself, there are another feature for students, and that's the companion website and the interactive exercises. That comes with the access code that's in the book. So that allows the instructor as well as the student to get a little bit more information and a little bit more depth if they have students that they want to use that as a class activity, or if they want to give additional extra credit, or for the student working independently if they just want a little bit more practice on a particular topic than what was covered in class. In the statistics chapter, and I will admit this was the one that I struggled with the most to make it as clear as possible. In the Essentials book, and it's in both books, it just happened to be the one that I have open here on my desk, I go into extreme detail on how to teach Excel statistics, because most of our students may or may not, but will not work in an agency or a facility that is large enough to purchase SPSS or SAS. And that also means that, you know, they may be in a less funded agency, or it may mean that they didn't have the opportunity to learn SPSS or SAS. So it is very useful for them, if they have access to Microsoft Office, they can do basic statistics, which will be very valuable for writing technical reports, putting together PowerPoint slides for stakeholders in the community, or making PowerPoint slides for conference presentations, depending on their either clinical setting or public health setting. So I'd make it as basic as possible, and in Chapter 11, there are many, many screenshots of the Excel website so that they know if they're in the right place. One of the things as a grad student that I found very frustrating with many, many statistics books is they leap from A plus B plus C plus D, and they only give you an explanation of how they acquired A and D, and you have absolutely no idea how they got B and C. So I went line by line by line through the explanation so that the students at any given point can look at their screen and figure out exactly what is going on. And from teaching this a couple of times, I now have students who are coming back to me in grad school saying, your book is the only way I survived Biostat 1 at the graduate level because you explained it in Excel, and then I can transfer that information to what it means in SPSS or SAS. So they seem to really like that feature a lot. In addition, there's an entire chapter on how to develop survey questions, because that is something that we do often, not only in clinical practice to get satisfaction surveys or get information from patients, or actually to do chart reviews of EMRs. You still need a code book or a survey in which to document that. In public health, we use surveys all the time in the community, and many, many community surveys are so poorly written that the data is practically useless because they did not start with a research question prior to writing the survey questions. So I introduce that. We talk about data entry, even though they may be using checkbox or Qualtrics, they still need to go back because of the random or systematic errors, mostly systematic errors in those software programs. So it gives them a basic introduction to statistics, and it allows them to not be afraid of the next level, so they can go back to this textbook if they need basic definitions. Features for the instructor is there are PowerPoints available. I made the PowerPoints on purpose to be brief, because when I use a new textbook and I get the PowerPoints and they have too much information on them sometimes, and you're not quite sure exactly how the author wanted that to be emphasized, so it was enough to put it on a PowerPoint slide. And so I made them in outline form, but giving you enough space on the slides that if you have a specific example from your own academic experiences, that you could slide that in without feeling like you have to delete the slide and retype it and do those kinds of things. It also includes a test bank, and I also tried to put in as many current topics that are available. Mostly we have a lot of emphasis on Healthy People 2020 and the MAP-IT concepts and the goals and objectives, so they can really see whether they're talking about clinical practice or public health practice, that Healthy People 2020 is really the framework for most of what we do in medicine and public health now. Looking at variations of health disparities, it's not just related to race and ethnicity. It could be sexual orientation, it could be age, it could be gender. So there's many ways that disparities come about. And then, of course, there's examples from all the different disciplines to, no matter if they're pre-med, pre-nursing, pre-MPH, they still can say, oh, I get that. I understand how that works in the context of this particular chapter. Unique features. The Chapter 2 on ethics, the case study that is in there is my personal experience. I was a whistleblowing nurse that led to a federal class action lawsuit. And I don't know if the person is on this webinar or not today, but I've already had a person from a university in upstate New York that was using my textbook and asked me if I would be able to Skype in and talk to her students in more depth about that particular case study. So for anyone on the website, on the webinar today, if you're interested in having me participate in one of your classes related to that, I will be more than happy to do that. I also teach budgets, not only budgets for grants, but I also in the budget section talk about how students can use Excel to put together their own personal budget and see exactly what their debt burden is going to look like in 5 years and how to calculate interest and those kinds of things. So that's available. And then lastly, reports and presentations and dealing with how to overcome writer's block, how to dress for interviews, what a portfolio would look like, those kinds of tips that students just need to hear over and over and over again, so I just include those. Teaching tips, I use the flipped classroom model when teaching this class, which means that I generally do everything that the lectures, the pre-recorded lectures and the PowerPoint slides are available prior to class. I expect the students to take a quiz, which they can take as many times as they want to. And then by the time they come to class, they need to be ready for discussion and small group work and to really apply the features of the book. Sometimes the students work in pairs. I try not to do group work with more than 3 students, because then you always have the emerging leader and the one that just sort of sits there and works on their smartphone for class. So I like students to work in pairs rather than large groups, and I allow the students to do different projects, but overall I use the class for the opportunity for students to develop a 5-page grant, and each chapter is part of the grant that they eventually compress into 5 pages and submit as their final project. So that's useful. And oftentimes for the glossary, if I feel like they're not getting something, especially in the statistics chapter, I have them create crossword puzzles, and there's many websites that have free software for creating software or crossword puzzles out of the glossary, and it just breaks it up so it's not death by PowerPoint, and they can learn using different learning styles in individual and group activities. So that's kind of an overview, and I'll turn it back over to Sophie. If anyone has any questions, I'll be glad to try to address those. Thank you very much for staying with us and participating this afternoon.
Thank you, Kay. So yeah, if anyone has any questions, you have a couple of options. If you hover over the top of your screen, you will see there's an option for a chat box. If you want to chat in your question, you can do that. We also have Erica, the operator, on the line, who is going to explain what you need to do if you want to verbally ask your question.
At this time, I would like to remind everyone, in order to ask a question, please press star then the number 1 on your telephone keypad. If you would like to withdraw your question, press star then the number 2. And we'll pause for just a moment to compile the Q&A roster.
Okay, and while we're waiting, Erica, while we're waiting for the Q&A roster, Dr. Perrin, I do have a couple of questions that have come through via chat. And the first question is, do you cover both descriptive as well as inferential statistics?
Yes, I do. They can hear your question. I don't need to repeat it, correct?
Yes, they can hear the question.
Yes. Chapter 11 is all inferential, and in prior chapters 9 and 10, we go into great detail about what you can and cannot do with descriptive statistics.
Great. So we have one more question that has come through via chat. While the book focuses on public health, do you think that it is broad enough to be used in a health administration program? And if so, at the graduate or undergraduate level?
Let me answer the second half first. These books were written for an undergraduate audience, but I will tell you that I'm currently teaching it at the graduate level, and I find that it works just fine. As far as healthcare administration, I think that you could use it. I have many examples in case studies and throughout the chapter that talk about things that would be very pertinent to health administration as far as monitoring staff and staffing issues, those kinds of things. What I don't have in here would be at the policy level or the personnel level or some of those kinds of things that might have to be supplemented if you really wanted a pure health administration course.
Okay, great. We have one more question. Do you coordinate the research agenda related to public health and the research course?
I do not coordinate the research focus here at USF. No, that's handled by a different committee of which I actually serve on, but I don't share that. And what was the second half?
Hold on just a moment. Let's see. Do you coordinate the research agenda related to public health as well as the research course?
No, not the agenda. I serve on that committee, but I do teach the research course, actually 2 of them, one out in the community called LEAP, Learning Experience Through Academic Partners, which is doing research out in the community, and then I teach the 2 sections of the research course for the undergrads, and 1 section at the grad level.
Okay, and there's a follow-up to that question from the same person. She's asking, meaning undergraduate research and evidence-based practice courses?
In the LEAP out in the community, the Learning Experience Through Academic Partner, that is a service learning type of course, and I do also coordinate that. And the other thing I didn't mention is I have taught both of the books in an online format and in a classroom format. Currently, I'm teaching the undergrads in an online format and the grad students in an in-class format this semester.
Okay, great. There's a question about getting in touch with you about Skype, Skyping into class, and I think what I can do, I can help facilitate that. If you'd like, Dr. Perrin, if there's anyone, shall I put that out to everyone in the follow-up email to contact me if they're interested in having you Skype into their classroom?
That'd be perfect. I'd love it.
Okay, great. So if you're interested in either a copy of the book or if you'd like Dr. Perrin to Skype into your class, you can simply reply to my follow-up email and I can help coordinate that. Erica, do we have any any questions coming through on the phone?
There are no questions at this time.
Okay. All right. Well, I would just remind everyone, if you do want to ask a question, you can hover over the top of your screen, click on the chat box, and type in your question there. Or as Erica said, Erica, I think it's what was the dial-in again to ask a question?
Star, then the number 1.
Star and the number 1. So if you want to verbally ask your question, star 1 or chat box. And at this time, I'm not seeing any further questions within the chat box. So Erica, if we have no further questions on the phone, I'm going to go ahead and wrap up the session. I do have here on screen my name and my email address if you want to make a note of it. If you think of something immediately following the webinar that you'd like to ask, I'm happy to follow up with Dr. Perrin with your question, or if it's related to review copies, or if you need access to instructor resources, I can connect you with those, or as I mentioned, a desk copy. So I think with that, I'm going to go ahead and wrap up the session. Thank you, everyone, for joining us, and thank you especially to Dr. Perrin for leading our session today.
Thank you.